This is just a short video to describe something that I've come across lately called dialectical behavior therapy. It's a lot like cognitive behavior therapy, and the cognitive refers to thinking, the behavior refers to the behavior, of course. And the idea is that rather than looking at the deep causes of your insecurities and whatever, you just try to change the way that you think and behave now, hopefully to achieve better results, a happier life. So this is just my understanding based on about a week of looking into this. So take it for what it's worth. So let's say you've got a goal, and the goal is to reduce uh, anxiety, becoming short-tempered with your wife, and irritated and angry and that kind of thing. So let's say that you want to do that. So what they ask you to do is to look at your vulnerabilities. What are the kind of things about yourself that might lead you to become irritated and angry and anxious, short-tempered with your wife? So one of them would be just being an irritable sort of person, being impatient, judgmental, spoiled, in my opinion here, and insecure. So then you have to decide what made you behave that way. That's called a prompting event. And in this case, it was calling the Canadian government for assistance. And this didn't happen today. This is the way that it went in previous examples, and usually really unpleasant. So I've got the vulnerability. There's a prompting event, like a stressor, you could say, and the result is anxiety, being short-tempered with my wife, irritated and angry. Irritated, spelled wrong there, I guess. So if you're looking at the anxiety, you can consider that there's certain possible coping strategies, and that would be deep breathing, mindfulness. And something that I came across recently is mindfulness is about putting yourself in the present moment. So one way to do that, it seems quite simple, and so far it's worked very well, is to just notice the things that you can see, hear, smell, taste, and feel. Just look around your environment and describe what you can see. I think it would be even better in a situation where you were people watching. That would really put you into the moment if you're sitting there and you're trying to describe the scene that's in front of you. When you go to make the phone call, be prepared. Have all your pens and paper and all the information that you might need. Okay. So then we go over to the irritation and anger, look at the possible coping strategies. One of them would be, remember that everyone is doing the best they can. That's a big part of dialectical behavior therapy. That's what they think it's important to do. They say that, remember that everybody's doing the best they can. And sometimes that's pretty incredible, right? I think you want to be mindful of that and grateful. Remember the goal. So in this case, the goal is I want to see if I can't get some money. And for not doing much of anything, so I should keep that in mind. Maybe I do have to do 5 or 6 hours of this kind of stuff, but I'm going to get money out of it. Remember to be grateful. I think I said that already. And remember the consequences of being emotionally dysregulated, the irritability, the anger, the stress on your heart, the indigestion, the anxiety, all of that stuff. Take the opportunity to practice patience. It's a primary virtue. And remember that there may be reasons for things that irritate you, right? So you phone up and you wonder why they do this, why they do that, and it bugs you. And it's probably a good idea to remember, actually, maybe they do have good reasons for doing things the way they do. The coping strategy would be to eat well, exercise, often avoid alcohol, and socialize. Remember that life can be difficult and challenging, right? Just remember that life is difficult. Or you could do this way. You could just get your wife to call. Haha, right? But I'm just kidding. Don't avoid things that make you anxious. Develop skills. Become more effective. And As far as I understand, they're asking you to look at every situation where you became, emotionally irregulated, and see if you can't figure out what you did wrong. You forgot that everybody's doing the best that they can. You forgot to do your deep breathing, right? You weren't prepared when you made the phone call. Something I think that it's important is to remember that emotions affect thoughts, and thoughts affect emotions, and it runs either way. And it results in behavior, and you can step in at any point. So maybe your emotions and thoughts are pretty scrambled, but if there's enough there of your thoughts to actually control your behavior, what I've been doing for years, because I've been living with this for years, is if I feel myself becoming dysregulated and having a bunch of thoughts that really aren't making that much sense, I can just sense that there's something wrong with them. Don't do anything. That's what I do. So you can step in at any point with your emotions, thoughts, or behavior.